Macular degeneration is a disease of the retina. The retina is the layer of nerve cells that lines the inside of the eye, and the visual center of the retina is called the macula. So macular degeneration is any kind of breakdown or sort of age-related damage to those cells in the center of the retina. So AMD is a shorthand term for macular degeneration, and people with macular degeneration tend to lose their central vision. Dry macular degeneration means that those cells in the center of the retina are damaged or breaking down. They can't transport waste products. On examination, we'll see loss of cells or some buildup of white waste products in the center of the retina where it should just be healthy pinkish orange cells. Wet macular degeneration tends to be more severe than dry macular degeneration. That's when you develop blood or fluid underneath the surface of the retina. People with wet macular degeneration tend to have worse vision than people with dry macular degeneration, although that's not always true. It's a disease of older people, and it's, as opposed to something like cataracts, which are reversible and treatable, macular degeneration is treatable and manageable, but it's not what we consider a reversible cause of blindness. And the older you are, the more likely you are to get macular degeneration. The biggest change that's happened in the treatment of macular degeneration is the advent of the anti-VEGF inhibitors, or the anti-VEGF injections that we do. So if you know someone who has macular degeneration, you may have heard about them going to their retina specialist and getting shots in their eye. And it really has revolutionized how well people do when they're diagnosed with macular degeneration. Prior to that, there were lasers, and then there were sort of targeted lasers. But then when these injections came online, it completely changed the prognosis for how people with wet macular degeneration do. And there are thousands upon thousands of people who retain their vision because these injections are available now when they weren't before. And I'll add, although it sounds horrible having a doctor stick a needle in your eye, I think most people who have these treatments will tell you that it's not actually as bad as it sounds. The anesthesia is excellent, it's quick, and it's really not horrible for them. So in general, in macular degeneration, smoking is a strong risk factor for the progression of macular degeneration. Eating a well-balanced diet, specifically one that includes antioxidants like vitamin C, vitamin E, zinc, that you find in leafy green vegetables like kale is important, and then also omega-3 fatty acids, which are what we find in fatty fish like salmon and sardines. So that's really important. Diet is important. Avoiding excessive, massive sunlight exposure. You don't need to have a hat and sunglasses on all the time, but if you're going to be out somewhere where there's a lot of sun, protecting yourself from excess sun exposure may be a factor as well. There are a lot of things where your prognosis will be better if you get a routine exam earlier. I think it's important to emphasize that there are things that are silent, things that can hurt you that you will not notice in any way. There are diseases that can be vision threatening that won't cause red eye or pain or worsening vision, anything that you would notice until much later in the disease. So a preventative screening eye exam is important for everybody.